Imagine if one of these newborns was your child. Alive, we believe, at the time the photo was taken. According to doctors at al-Shifa hospital, fuel for generators has run out. Babies taken off incubators, huddled together to stay warm. What would you say to Hamas, accused of using them as human shields? What would you say to Israel, who've been bombing day and night for a month?
The staff of the Shifa hospital has requested that tomorrow we will help the babies in the pediatric department to get to a safer hospital. We will provide the assistance needed.
But what and where exactly is safer? Premature babies, kidney patients, specialist surgery. Thousands at al-Shifa are now either being treated or taking refuge. And the tomorrow Admiral Hagari speaks of is now today.
What people don't seem to understand is that al-Shifa is the main tertiary hospital. It's a hospital that does really complex things, and no other hospitals do those things. So these patients haven't got anywhere else to go.
So in other words, the offer doesn't really mean very much.
I think any offer to help should always be taken in that spirit. But the most helpful thing would be to cease the fighting right now. That's the practical thing. It would be also what we'd like to see is the hostages returned, and the fighting to cease.
As we go to air, the Red Crescent saying al-Quds hospital in Gaza City is out of service. Flee down south to Khan Younis. The bombs are falling here too. Nasser hospital still functioning for now.
We thought that al-Shifa hospital was a safe place, but it wasn't. If we had stayed another 5 minutes, we would have been killed. They started to bomb us, and we ran away from al-Shifa. My son got injured, so I left him there. I just couldn't take him with me.
IDF footage released today against an awful spreadsheet of war. Thousands of dead Palestinian children, 240 Israeli hostages still held by Hamas. And tonight, what little progress had been mooted behind the scenes appears to have stalled. Hamas suspending negotiations for hostage release because, they said, of Israel's handling of the al-Shifa hospital.
Well, let's go live now to our foreign affairs correspondent, Sikandar Kamani, who's in Tel Aviv. Some very distressing images today.
Yeah, that's right. And I've just been speaking to a doctor at al-Shifa hospital on the phone. He said that no one had been evacuated from the hospital. He said that of those very young babies you saw in the report, 2 tragically died yesterday, another one died earlier today. And he was deeply concerned that none of them would survive because they're, he said, trying to do their best and keep them warm in the operating theatre where they're being kept, but they still are unable to run the incubators that they need. Now, Israel says that last night it tried to drop off 300 litres of fuel for the hospital, and it alleges that Hamas then prevented staff from accessing that fuel. This doctor I was speaking to denies that. He says that no one from the hospital was able to go and access the fuel because he says they were too worried about being shot by Israeli forces. He also said that 300 litres of fuel would do very little because the hospital needed at least 10,000 litres of fuel to keep running. It seems there's a real war of narratives between the two sides, as well as a real and very deadly war going on. Hamas has said that it's reportedly breaking off negotiations because of the events around al-Shifa hospital, negotiations around the fate of the Israeli hostages. There had been reports of a deal underway to free a large number of them, but it's unclear what level of progress had been made.
Sikandar, thanks very much. Well, Lieutenant Colonel Peter Lerner is a spokesperson for the Israeli Defense Forces, and he joins me now from Tel Aviv. Lieutenant Colonel, you were hearing there from our correspondent about this terrible stalemate over the fuel for al-Shifa hospital. Premature babies are at risk of dying, dozens of them. Will you undertake to suspend military operations until they are safe?
Kathy, this evening and overnight, the IDF has conducted extensive efforts in order to alleviate some of the challenges that the people of Gaza, and specifically the people in Shifa hospital, are facing. He rightly pointed out that we try to supply, not without risk, mind you, some 300 liters of fuel to the hospital. We put it out. The soldiers were carrying it. And unfortunately, the hospital, which it appears that Hamas is preventing the access to get the fuel for the hospital itself.
Okay, so while this horrendous stalemate continues, and the hospital, by the way, says that it needs 10,000 litres of fuel, you know, it's a war of words, it's a war of narratives. Will you not undertake a humanitarian pause just to ensure the safety of these incredibly vulnerable patients?
We're trying to give the access, the needs for the people in the hospital, specifically for the babies, while we're trying to increase efforts in order to evacuate them. You know, nobody wants to see these images. It is indeed tragic and horrifying what the people of Gaza are going through. But ultimately, if Hamas is preventing 300 litres from going into the Shifa hospital, why wouldn't they prevent 10,000 litres? Why wouldn't they prevent 1 million litres?
Okay, but you speak of evacuating the babies there. You speak of evacuating the babies. How can you evacuate babies that are so vulnerable? And so I wonder whether the only answer isn't for a pause in fighting to ensure their safety.
There is no fighting at the hospital. People can evacuate the hospital. We've seen tens of thousands of people evacuate over the last few days, over the last 5 days. More than 200,000 people have evacuated.
Okay, so where are they going to go? Because nowhere in Gaza is safe at the moment, is it? We've seen bombing in the south, and premature babies cannot be evacuated.
Kathy, where there's a will, there's a way. We've been trying to make that way in the last 24 hours extensively. The only will that is being prevented here is Hamas's will to continue to hold 239 Israelis hostage, to continue to hold the 2 million people of Gaza hostage. We are in a war that we did not choose. They strategically opened a war with Israel. They have to go. This is what we are determined to do.
Okay, so is the most urgent priority, and apologies for interrupting, but we're running short of time.
United Nations
facility. If I could just ask this question.
This is a challenge that we are facing. Yeah. We are determined to make sure that they never wield this sword of death.
I'm sorry that we're running short of time, but is the most urgent priority now to tackle the Hamas fighters that you say are in this hospital, or to save these premature babies and other patients?
Absolutely. We are trying to save these babies. This is exactly what we've been doing since Admiral Hagari spoke yesterday. This is what we've been trying to do. Hamas have been putting barriers in it. And the Ministry of Health in Gaza, which is Hamas's Ministry of Health, is just a tool in the theater of death. This is what they're doing. This is what they're trying to do. Instead of being part of the solution, they are continuing to be part of the problem. This is the true tragedy of the people of Gaza. This is why they are being held hostage. This is what needs to be dealt with, Kathy.
Lieutenant Colonel Peter Lerner, thank you very much for joining us.